We talked a little bit about the work we've done on the impact of obesity on cancer. So basically, how is that the adipose tissue promotes tumor progression. And what we found was that there are many ways, but one of them is through inflammation. So adipose tissue generates a lot of inflammation that then promotes tumor progression. And this tumor progression is mediated via deposition of desmoplasia or fibrosis, as well as infiltration of immune cells that drive tumor progression. Well, I think cancer normally appears at later ages, in older, most forms of cancer, right? Since it's a disease that takes a long time to develop, it will appear very late in a person's lifetime. In terms of obesity, it's actually it's so prevalent these days that it happens very early on, right? We are already experiencing childhood obesity epidemics as well. So I don't know if age will have a sort of like a synergistic impact on this interaction between obesity and cancer, but to some extent they correlate with at least cancer. That's a good question. I think there's some people looking into that. We didn't explore that. We were more interested in how obesity affects not only tumor progression but response to chemotherapy. But based on our study and other people's studies, it probably will have an impact in cancers that late stage, that are latent, and they take a long time to grow. And for instance, in pancreatic cancer, we know that it's a cancer that develops very early on. So by the time it's diagnosed, it has been there for many years. So probably if you have an obese phenotype when you're younger, it probably will have some impact. What we found was that in the obese setting, there is more inflammation in cancer, and that promotes accelerated tumor progression. So we know that in patients, if they have excess weight, they have a worse prognosis. And what we've discovered is that may be explained by increased inflammation and increased fibrosis in tumors. So what we propose is, first, we believe that we should consider using mouse models that reflect patients, which means using obese mouse models. And second, we can extract information that is applied to patients. So we found that a number of drugs can be particularly useful in patients that have excess weight. So when we design clinical trials or we attempt to use a new drug, we should take into consideration that body weight is important for drug selection. We're actually trying to finish another project in breast cancer. So what I presented here was essentially pancreatic cancer. But some of these findings also have an implication in terms of driving breast cancer progression. Breast also has a lot of adipose tissue, so we're studying the interaction between adipose tissue and breast cancer cells, and we are finding that in obese patients also there is a worse prognosis, accelerated tumor progression, and that's what we are now exploring.